All right, we are recording now. Good morning, guys. This is Luis Moreno with Medicare Advantage Mentors. We've got today with us, we've got Sam and Marco from RxSavers going to do a little presentation on how their program can help our seniors out with prescription drugs. And so, Marco, good morning. Are you there?
Good morning. How are you guys? Can you guys hear me?
We're doing great, man. First of all, thank you again for being on our conference call this morning. And
no worries.
So we are now going to do the presentation where these agents can see these screens. If you would, when you want me to flip from one screen to another, I'll be the human mouse click. Just tell me when to move to the next screen, and I'll go ahead and let you take over. And let's go ahead and get started.
Yeah, of course. My name is Marco. Well, we started RxSavers a couple of years back. It was founded by a couple of individuals trying to help people get their medications for free and getting them the help they need. Well, let's go ahead and go to the next page, and I'll go explain a little bit about RxSavers and what we do and why we're so effective and so helpful to all our clients.
Okay.
We are a prescription advocacy program in which we help our clients get their prescriptions completely for free through the manufacturers. All pharmaceutical companies have something called PAPs, Patient Assistance Program, in which they are eligible for to qualify and getting the medication for free if they qualify based on the criteria that they need. Okay, each medication is different. Each pharmaceutical code is different. There's over 50 different manufacturers that we help with, and we work alongside with. We have an extremely high successful rate. We have over a 92% approval rate. We had a 91% approval rate last month. Okay.
And did I hear you right? Did you say 92% approval rate?
Yeah, over a 92% approval rate.
Gotcha.
If I'm going too fast, let me know, all right? Basically, going through us is so effective because if someone decides to go by themselves and go through the manufacturer by themselves, that's completely fine. They can definitely go ahead and do so. But someone that hasn't done it before and don't work alongside with the manufacturers, they don't know exactly what they need to provide. Either provide one piece of information, they will get denied and they won't be able to get the assistance for a full entire year. They won't be able to reapply. So many cases that the patient goes ahead and says, you know what, I don't need to pay your program just because they want to save $39.95. They'll call in and they'll go directly through the manufacturer, but they call us back saying, hey, I just got denied. Can you help me out? And unfortunately, we can't because they already got themselves denied. Sometimes we are able to fight it and get them approved, but that is why it's so effective to go through someone that knows what they're doing and knows how to work the system and how to get them approved. The next slide.
Okay.
That's exactly what everyone was asking me, how much the plan costs. I've never seen anyone taking over 7 name brand medications. I have seen 5. Okay. Our program starts at $39.95 for every name brand medication that you guys add. You just have to add $10. The enrollment fees go from $25 to $75, and that's something you would go ahead and discuss with your upline and what they're going to charge their clients, the enrollment fee.
Okay. Now on these medications, just real quick, it doesn't matter their generic or brand name. A medication is whatever it is, and they want help with. Well, there's no differentiation between generic and brand, correct?
So with generic medications, we don't need, we don't care about their income. So there's no income requirements. Okay. At all.
But they can still apply, right?
They can still apply.
Okay.
We can still help them, but if you have a different prescription plan with you guys, like the generics are their main concern is not going to be the generics. They're going to be so inexpensive. A lot of people in some cases that do talk to us are taking generics, but they're taking the generic because they can't take the name brand, and that's when they switch from the generic to the name brand with us. Those are the people that are usually taking and worried about those generics.
Got it. Okay.
Next slide.
Okay.
Our quick qualification tool will be in the next slide, in which I will be able to show you right there. So that's how it would look, and the website would look like. all right, in which you would be able to put in the name of the medication. In that slide, it says Eliquis. They started out with ELI, okay? You would go ahead and search for the medication in the search bar.
Okay.
Okay, this is where you guys would need to focus on because this requires if you have Medicare Part A or Medicare Part D, all right? If you have Medicare Part A and Part B, you don't need to worry about the Medicare Part D slide. You don't need to worry about that at all if you don't have Medicare Part D. So
Okay.
if you have Medicare Part A and B, like it says, Eliquis is available all year. They just don't need to have script coverage. But if they do have script coverage, they can't help. They just have to meet a 3% out of pocket out of the household income.
Okay.
You would only just need to calculate it. To calculate what's their income guideline, just go to the next slide.
Okay.
And it would be right there. For Eliquis, it would be a household of 1, 36,000, household of 2, 49, and so on. Like Sam said, they look for 2019 tax returns. They look for Social Security benefits, pensions, and all that. If a client is taken, we don't tell all this to our clients, but we'll tell this to our agents. If the client is taken a name brand medication and through work, they're working part-time and they're making X amount, but they also have Social Security benefits and they make X amount. They have pension and they have an X amount, right? Like I'm not giving an exact how much they're making, but if you guys have any questions on what I'm trying to explain, just I can answer those questions.
Okay.
If the Social Security benefit reaches the income or is inside that income, you would still be able to enroll it because we would be able to help out with that medication. So if with their tax return, through their wages and Social Security, they're over income, but through Social Security they qualify, you can call ahead. They will most likely be approved.
And let me see if I can get this right. So we're talking about Eliquis. So I'm going to go back to the previous slide. On Eliquis, okay. I see it's 300% income, and then out-of-pocket requirement 3% out-of-pocket household income. So if I have a senior, and let's say that they are married and their combined household income, is it adjusted gross? Is that what they're going by?
Yep.
Okay, so let's just say their AGI is 30,000. So technically here, a household of 2 needs 49,000 and change. They would qualify for this, right?
Correct.
Okay. All right.
That's where I also say if through Social Security or wages they're inside that criteria, but if they put both of them together, they or over income, we should still be able to qualify them. We would just request one source of income to be presented.
Okay.
That we go ahead and just tell you guys. We will never tell it to the client.
Okay, got it. So you all know what to work out. Now, as far as the insured, so in my example here, where they have they're making 30,000, and for Eliquis, what does the 3% out-of-pocket household income? This portion right here, what does that mean?
So basically, for that portion right there, it says 3% out of pocket if they have Medicare Part D only. So if you have Medicare Part D only, that's when you would look into, if you have Medicare Part A and Part D, you would look into the 3% out of pocket. So you would ask the client, what's your household size?
Okay.
And then you would calculate the household size and the household income. You would calculate the 3%. Whatever the 3% is, they will need to show that they've reached that out of pocket in all medications they paid for. Okay. So for example, and if they have Medicare Part D, they get a benefit statement every month or every 2 months. Is that correct?
Yeah, typically it'll be every month.
Right. And in that benefit statement, it would say exactly how much the client has spent out of pocket.
Okay.
All right. If they don't have that, they can go ahead and go to their pharmacy and tell them, can I get a pharmacy printout of how much I spent out of pocket for this medication? and we would be able to accept that as well.
And so the
Anything that,
would the copays go into this calculation?
yep, it should go into that calculation. Is all based on how much the client has spent out of pocket for all their medications, not just for that medication, Eliquis, but all their medications combined.
Okay, got it.
Okay, each if you put Novolog, if you put different medications, it's all different. It's not always 2%. Sometimes it would say $600. Some would say 1,000, but that's the max it would say. I haven't seen anything higher than that.
Okay, got it. Okay,
Yeah.
makes sense to me so far.
Next slide.
Okay.
I later on, if you guys have questions about different medications, I'll send you a link, Louis,
Okay.
and you'll be able to log in, and we would be able to just share that screen, and you can go ahead and test it out with different questions any different medications that you have questions on.
Okay, perfect. Well, you send that to me, and then I'll hop in here.
Yep. And let's go through it. This is what it would look like to apply when everyone's asking how do you apply? How can we get the client enrolled? You will need to get appointed with us as first. Just go through your perspective upline.
Okay.
All right, and we'll go from there.
Okay.
I'll go ahead and provide my contact information. You would click apply.
Okay.
Once you click apply, you would go to a slide that you would choose the monthly premium or the monthly cost for the plan. So if they're taking one name brand, it would be $39.95. 2 name brands, $49.95, and you would be also be able to choose the enrollment fee. Okay. You would go ahead and you would click submit. You go into this page right here, exactly that page that you have it on, Luis, and you'd be able to put everything that's highlighted, everything that's required, which is in red. First name, last name, address, zip code, phone number, email address, social security. We do need it. Date of birth, gender, and just so you can put the name of all name brand medications that you need help on.
Got it.
Okay. Now, in the next slide, go back. Louis, go back.
Okay. Right here?
Yep.
Okay.
And the other side, it would say RxSavers LLC. That's the terms of service that they would get. Underneath, it was going to say how you can send the terms of service.
Okay.
It would be through their phone. They can get it by text or their email, and they'd be able to go ahead and do it through there. We will have a voice verification, which is getting set up, and we'll go ahead and provide that to all our agents. Above the terms of service, they would require the credit card or ACH bank account, and you just go ahead and put that information in there. Very important thing, how it says is right there. You can send it through a smartphone or email, but before you go ahead and click submit, you have to wait for this blue box right there to be green. It would turn green as soon as the client has signed the terms of service. Once the client has signed the terms of service, you click submit.
So it's instant. I get all this done, put the medication name, put their credit card information, check that. And if I have them on the phone, I'm going to send them a link. Is it like a DocuSign kind of link that they get?
It's a DocuSign, is a kind of the DocuSign kind of link.
Okay.
It's a wet signature. Basically, once they have that set up, once they have completed it and once they've submitted it to you, the blue box right there is going to turn green where it says important.
Okay.
Yep, that's going to turn green as soon as they have completed the terms of service. Once they have completed the terms of service, the client's going to go through the next process, which would go through us. All right, go to the next.
And did I hear you right? Is it this signature and also a phone signature, or is it either or?
Either or. They get it through the same thing. It's just a link that they get through a text or an email. They click it. They'll have access to their form,
okay,
in which they can download it themselves so they can have their own copy. They'll go ahead and sign what they need to sign. And once they completed it, they'll submit it to you, and that's it.
Okay, got it. And let's just assume it's one of these seniors, old school, they got a flip phone, they don't have a smartphone or a computer. They can do the signature by voice?
Yes, that is getting set up, and we'll go ahead and provide that a verification, an online verification, a phone verification, in which they'll just listen and say, yes, I agree, and so on and so on, so we can continue to help them out and get them built and get them started.
Is that will they also get that, you know, let's just say the senior tells me, hey, I don't have email or whatever. How do we also send a link, or is it a different procedure?
And the voice verification is not set up yet. That would be sent to you guys, and we'll go ahead and advise you what's the process from there. As soon as we do have it set up, it should be done within the next week or two.
Okay.
Or we are working on that.
Okay.
Yeah, we're just getting our lawyers to review the voice ver.
Perfect. But for the time being, they've got a DocuSign. And I'll tell you what, guys,
right.
I've had my seniors do that. It's pretty easy. They can do it while they're in front of you. But if it's DocuSign, I mean, any smartphone, it can be done. It's super, super easy.
The next click is the process that your customer is going to go through. You have already completed step 1 and step 2.
Okay.
You have qualified the client and see the client qualifies for the medication. You have already sent the electronics terms of service. They have signed it and sent it to you. Okay. They're already in our CRM. Okay, so they have already reached our spreadsheet where we need to call them and get all the clients' information, such as medications dosage, quantity, how many medications they also need help on, doctor's information such as first name, last name, phone number, fax number, and different information we need from the doctor. As soon as that is completed, we send them all paperwork within 24 hours to their email, or we can mail it to them. We send it to the doctor by fax, and we email the client usually.
Okay.
That's how this one says the medication would typically get delivered within 3 to 6 weeks. We do follow up with all our clients 2 to 3 times after we send all information that we need, just to advise them that we're still missing paperwork. And after we receive all paperwork from the client, we advise them by phone call or email what's the process, what's the next process that they need to be doing, or if they're just waiting for it to get approved.
Got it. And then as far as renewing this, is it an annual renewal type of thing that these insureds have to do?
The agent would not have to do anything. Basically, it depends on the medication. Sometimes I have clients that only need us for 3, 4, 6 months, depending on their medications. I have other clients that need us for the full year because we can help them all year round. So after the year's over and we need to help them out with their re-enrollment for the paperwork with the manufacturer, our CRM automatically lets us know, as they let us know automatically regarding the refills. So they're not waiting on the refills or the re-enrollment. That would be sent to them automatically as soon as our CRM notifies us.
Okay, perfect.
This is the portal you guys would have access to. You would be able to click the client's information, such as by email, first name, last name. I'm not sure you guys are familiar with this CRM, but you would be able to click the client in the next slide. You would be able to find the client through here.
Okay.
Here, you view your members. You can also find your clients to view your members. You can click on their link, and it will tell you if the client is active, what's going on. The client is active, and payment declined, if they charge back, if they canceled, and so on and so on. Maybe you have any questions regarding what's the actual status on their paperwork, you can just reach out to me, and we'll go from there. Do you guys have any questions?
Perfect. One question that I do have for you is this only for people that are on Medicare, or can they use it for people under 65? Marco, did you hear me? Marco, I think you muted your, there you go. Now there you are. You unmuted yourself. Hey, Marco.
Yeah, I'm here.
Were you able to hear my question?
Yep, I was able to hear your question. So I can help out people that are underinsured, no insurance, Medicare Part D, no matter their age, as long as the doctor sends us the secure blank, which is a prescription written in the prescription pad, okay, and the doctor is going to help out the client through us. That's all we need.
Okay, perfect. And then one scenario that I run into is sometimes you'll have seniors that that file two different returns, or they're not, they're married, but then they're not married. They file separately, or they don't file at all. Income wise, are you just going to be looking at the income of that one particular senior, that the wife or the husband, or is it a combined type of thing? How do you differentiate that?
So most likely, most of our seniors sends us their social security benefit statement, and we ask them from the beginning of the call, hey, how many people in the household? If they tell me I live with someone, but we are separated, then we would only ask for their income, not for that spouse's income. Or if there's married or was just legally separated, we would ask just for their specific income, not the whole household. It just depends on their status, on where they're at.
Okay, got it. Guys, we do have a few agents on the phone with us. Do any of you all have any questions of Marco, or you want me to go through these slides? Please hop in. I think all you've got to do is unmute yourself, and you can hop in and ask a question.
Louis, I'm going to send you the link.
Okay.
I'm going to send you the link, and I'm sending you the what you guys need, what you need to log in, so you'll be able to work. So you'll be able to go into our slides, and if you have any questions, you can look up the medication there. All right, just bear with me 1 second.
Perfect.
I have a question. How do we get signed up to be appointed for this program?
So basically, we would go through your upline. Once we go through your upline and make sure they are appointed with us as well, we will send you the link. I can go ahead and send you my direct information if you have any questions with training or any questions at all. My information, my phone number, my email is always available to all you guys. But we would go through your prospective upline.
Who was it that asked that question?
Bill Hurlin.
Hey, Bill. Okay, so are you under Matt or David?
Yes, under Matt.
Under Matt. So yeah, so just get with Matt, tell him, hey, I need to get on this program, and we'll get you set up.
Okay, great. Marvelous.
Right.
Yep.
I'm sending you the login. I'll do it right now. Hold on a second. I can still hear all your questions right now.
Okay. I'm waiting for the email to come through.
You can go to our website, which is www.rxsaversllc.com. I'm sending you the login information right now.
RxSavers. Okay.
I'm texting it to you. What's
the
password?
Okay, I've got it. Right.
Username and password.
Okay.
All right.
Where's the login, man? Where do I click?
That's not it. Go to.
Okay, sorry. All right.
Those are the
RX. There we go. Perfect.
Thank you.
Okay.
Med lookup. Go to med lookup.
Okay.
And it's gonna. Right there.
Okay, so one of the ones, let's look up one of the flex pens. Let's go with, I guess maybe. So one of the flex pens, I think this is it right here. Novolog. So let's just look at this Novolog. It's one of the insulins.
Okay. Novolog flex pen?
Yes.
All right, just bear with me 1 second. I'm logging in myself so I can see it in my screen. So for the Novolog that you're right there, we would only be able to help out with the vials only. The only way we can help out with the FlexPen is if they are grandfathered in through that manufacturer already. They've already gotten the assistance. So for the Novolog, it would be 400% FPL. The medication would be completely for free for the vials only.
Okay.
They do not accept any type of insurance. So Medicare Part A, Part B, but if they have Medicare Part D only, we would be if they have Medicare Part A and B and D, we would help out with the medication. The patient must spend $1,000 out of pocket.
Okay, got it.
You can look up Januvia.
Januvia, okay, let's go to Januvia. There it is.
That's an example of what I was telling you guys. That not necessarily is the data how to reach the donut hole. So for example, if they have Januvia, they'll be eligible all year.
Okay.
So completely be eligible all year.
Okay.
So we start helping them out in January, as soon as January starts, or right now.
Perfect. So let's assume that that's what my client has and that's what they're having an issue with. I know that this medication typically is a tier 3. Let's calculate, let's say that they make income requirement. Where do I plug that in?
The income would be, household of one would be 48,560.
So it doesn't
You having issues?
type anything in here. So let's assume that they're under. At this point, I would proceed with the next steps, right?
Yes.
Okay, easy enough. Okay. For some of you agents that are on our call here, on our webinar, do you have any questions of Marco?
This is Bill again. So I have a question. If it says they don't have insurance, so if they've got an MAPD plan and they've hit the donut hole, let's say in June, and so now they want to know if they can participate in this program, like for Januvia, for example. And let's say there's 2 people, they make $28,000 a year. It sounds like they're going to qualify. And it's still, what will they end up paying for that medication?
The medication would be completely for free. It would be delivered to, let me find out exactly where the medication would be delivered.
Oh, wow. Okay. So basically it's costing them $30 a month for the medication that they've been, or whatever, $39 as compared to.
Correct.
The
medication would become, and the medication will be delivered every 3 to 4 months. So they get a 3 or 4 month supply at a time.
And not have to pay for it.
And not have to pay for it. The only thing they're paying is for the assistance for us helping them out with their medication, getting them approved, the refills, etc., making sure there's no hiccups along the way. And the medication will be delivered to.
Yeah, that's not too bad. It's $39 versus the full cost of those medications. That's a big difference.
Yeah, it's huge difference.
Doctor's office.
Yeah.
Great question, Bill. Thank you.
So to get enrolled in this program, we just basically go through our upline, we do the appointment paperwork, and then we'll get a username, password, and we can get into this and check it out for.
Correct. You'd have access to what Louis has up right now, and how to enroll the client.
Okay. So my other question is, what are the income levels like for individual and for household members?
Individual, the income levels start. They go from the good thing is that every single year the poverty guidelines go up.
Okay.
All right.
All right.
So that's a good thing. Each medication is different. Let me see if I can go ahead and do. Novolin is 400%.
So he did mention a term that some of you guys may not be familiar with. He said FPL, and what that is, that's the federal poverty level.
Right.
So there is a flat number depending on the household, and I guess you multiply it by whatever the 200, 300, 400% is.
Yep. I've seen the poverty level be as high as 600%. 600% FPL, it would be household of one, 72,000, household of two, 98,000. So it's not always all the same. That's what I would always advise you. Look into it and see if they qualify for that medication.
You know, guys, and most of the seniors that we're visiting with, and I tell a lot of agents this, most of the seniors that we run into never plan for retirement. And so all they're doing is living off their Social Security checks. And so these programs are going to be able to help them quite a bit. So Yeah, I guess, you know, if they're over that level, they probably have the money to afford those drugs.
I have one more. Is there anything, is it all based on income? Is there anything with, you know, how much money they got in the bank or anything like that?
No, not at all. It's based on income, but like I said, there's different ways you can cut the cake basically, or the pie. Basically, if they're over income, but through one of their income, one of the ways they get income, they're under that FPL, they should be able to get approved. We don't tell that to our clients, we tell that to our agents.
Right, I got you. No, that's perfect. I've got people today.
Awesome. So we'll just get with Matt. As soon as we get off the phone, get with Matt, and we'll do what we can to get you set up immediately.
Great. Thanks, Louis.
Okay, you're welcome. You're welcome. All right, Marco, I think we're good, man. You did a good job of explaining it. It seems, you know, I like the ease of it. And, you know, we just put some information and we walk away, and then you guys take over.
Perfect. I'm always available. If you guys have any questions, you can always shoot me an email or a text or a phone call.
You know, and guys, here's what I'm going to do. Let me get to my email, and I'm going to share. Marco, where are you at here? All right. So I'm going to move this over. Give me 1 minute. Okay. I'm going to put this on the screen so you guys can see. There is his information. Okay. His name, his email is up there on the top, and then there's his phone number.
What phone number is there? Can you help me out with that?
It's an 877 number.
Write down this number: 561.
Okay.
221. 3150.
Okay.
That's my phone number. That's my direct number. That number is our customer service.
Okay.
When you call the number, most likely you're going to speak to one of my reps. You just tell me if you're looking for Marco. They know exactly. They'll push you. They'll give you my phone number, or I'll give you a call as a call back if you call that number.
And
so,
repeat that cell number one more time, please, or that direct number.
My cell phone number is 561-221-3150.
Perfect. Okay. All right, guys. If we don't have any more questions, oh, go ahead. Okay, so I think we are done. Okay, so no more questions, Marco. Appreciate your time, and we'll start getting agents going your way and see if we can help more seniors out there.
Perfect. It was a pleasure speaking to all of you guys. Stay safe out there. All right.
Okay, we'll do, Marco. Thank you, buddy.
Thank you. Bye.
All right, bye-bye.